Greeting from Yenepoya, deemed to be University, Mangaluru. Today's session I am going to talk on special care dentistry. Myself, I am Dr. Sham S Bhat, Senior Professor, Department of Pediatric and Preventive Dentistry and Dean Faculty of Dentistry, Yenepoya Dental College. At the end of the session, you will understand what are the special needs, oral health problems in special needs persons, barriers to oral health, role of special care dentistry, brief strategy in treatment, challenges for special care dentistry. Some of the definitions and some of the terminology used in the special dentistry are: impairment is an loss or abnormality of physiology or anatomical structure or functions. Disability, any restrictions or lack of ability resulting from impairment to perform any activity within the range considered as a normal for a human being. Handicap is seen in disadvantages for a given individual resulting from an impairment or a disability which limits or prevents the fulfillment of a role of that is normal, that depending on the age, sex, social and cultural factor for that individual. People with disabilities needs higher and special health care compared to the general population. Some disabilities may have multiple health conditions or may involve multiple body functions. Indian national policy for a persons with disability recognizes that persons with the disability are valuable human resources for the country and seeks to create an environment that provides equal opportunities, protection of their rights. Our Prime Minister PM Narendra Modi suggested the term Divyang in his Accessible India campaign in 2015, which translates into a divine body for a person with disability instead of a usual Vikalang or handicapped. And he said persons with disabilities are divinely blessed with extra gifts. To talk about special care dentistry, that part of a dental practice which deals with the patients where the intellectual disabilities, medical, physical or psychiatric conditions require special methods or techniques to prevent or treat oral health problems, or where such conditions assist special dental treatment plans, that is by ADA, that is Association of American Dental Associations. Special care dentistry, that is SCD, is a delivery of dental care tailored to the individual needs of a patient who have disabling medical condition or a mental or a physiological or a psychological implement of limitation that requires consideration beyond routine approaches. Special needs issues in children may be medical, may be developmental or learning, mental health or a behavioral. What are the needs? Increases in the number of people with disabilities with multiple medical conditions leading to impairment, or absence of follow-up and maintenance care, or reduced awareness among the people to access the health care. Now we will see let us the barriers which happens in the special care dentistry. It may be individual or it may be dental professional. Under the individual, lack of perceived needs, anxiety or fear, socioeconomic status or a financial consideration or a lack of access. Under the dental profession, inappropriate manpower resources, uneven geographical distribution, training inappropriate to changing the needs and demands, insufficient sensitivity to the patient attitudes and needs. Coming to the societal barriers, insufficient public support or of health attitudes, inadequate oral health care facilities, inadequate oral health manpower planning, insufficient support for research. Considering the government side, the lack of political will, inadequate resources, low priority. These are the methods which you use the examination section, or do the child when need a support system like infrastructure modifications, hearing and in visual impairment, wheelchair users, managing the changing behaviors, ensuring the airway patency, referral for a treatment and consultation by the specialist, intercollaborations with other healthcare providers or a physical interventions. Special care dentistry necessary for persons with severe movement disorders, chronic mental illness, persons who are adult in age but who functions at the child's level, those with a serious medical condition who are at risk for the adverse outcome in the dental settings unless treated by the knowledgeable practitioners. If you consider the categorization of special needs, you can see on the side physical disability is 41% and locomotors are about 23%, rest of things almost 30%. Now who can treat this special care dentistry? It needs a multidisciplinary team where the patient, parents, dentist, dental profession and non-dental profession are involved. The main objectives of care are to motivate the patients and caregivers to maintain oral health, prevent infections and tooth loss, prevent the need for extensive treatment that patients may not be able to tolerate due to their physical or mental conditions, and make appointment as a pleasant and comfortable. General aspect of oral status in impaired patients, one is poor cooperations, less importance to the oral health, resistance to the mouth cleaning, challenging behaviors that are sensory impairment, limited access to dental services. Now dental care is in the special needs patients that high prevalences in the patients with the impairment are more untreated decay, more missing teeth, fewer restorations, malformed or hyperplasic teeth, or high incidence of malocclusions. Now these are the conditions you can see the caries involvement or maybe gingival disease or a gum diseases. Now how to prevent this? Preventing dental caries in a special needs topical fluoride, high doses or a high fluoride toothpaste alternative with the fluoride mouthwashes, dietary constitutions for a different forms, that is liquid oral medicines may be used for the chlorhexidines, gel or a varnishes, a traumatic restoration as a treatment choice for the preventing the dental caries. Now these special needs have tooth attrition problem or a tooth aware wear and tear depends on the conditions like a neurological impairment, clinching or grinding causes attritions, cerebral palsy, gastrofacial diseases, omitting or erosions, different type of oral habits. Now coming to the gingivitis in special needs, poor oral hygiene resulting in a plaque accumulation in gingiva, Down syndromes more prevalent of periodontal diseases, early loss of tooth. In epilepsy, medications is the addition for a gingival growth, and mouth cleaning may be the caregivers needs a more mission on to clean the oral cavity. These are the gingival angiometry you can see in that patients. Now to prevent the gingivitis in special needs patients, we can use modified manual toothbrushes, changes medications or modifications doses, mouth cleaning resistant patients, power brush can be advised. Now in these special needs patients, they have a tendency to do self-inflicted trauma, especially in self-mutilation involves moral tissue in certain syndromes. Teething sometimes trigger this type of self-inflicting, lip and tongue bitings, pain and swellings, mouth is too sore to drink or eat, dehydration and hospitalizations. Now coming to the preventing the self-inflicting trauma in special needs can be removal of the primary teeth which was offending and use of soft plinting to prevent soft tissue trauma. If malocclusion, teeth adjustment or orthodontic treatment can be advised. These are the offending tooth we have a trauma. Now preventing the hypersalivation in special needs, excessive drooling, especially in the poor neuromuscular controls, maybe prevention and management can be needs surgical and pharmacological or radiotherapy, palatal training, aids or a behavior modifications. Xerostomia in special needs patients. Xerostomia can be associated with the syndromes, medications, early patients, elderly patients and patients on radiotherapy result in increasing rate caries and ill-fitting dentures. Now coming to the preventing the xerostomia in special needs, one radiotherapy, pre-operative dental care, avoid extractions, high dose of fluorides, usage of chlorhexidine mouthwashes or gels, saliva stimulations, saliva substitutes can be used for the preventing xerostomia. Now drawbacks under this, both government and the patients burdened by the cost factors treating dental problems for these populations. Information describing the special needs care provides a training the curriculum needed for this specialty are limited. Now dental graduates are increasingly being challenged in treating patients with special care due to lack of emphasis and even absence of special care dentistry curriculum in BDS educations. Overcoming challenges in managing the patient with special care dentistry may be an issue for the dental professionals. Now let us see world scenario. In United States, no trained dentists were available, provided treatment for the adults with the special care needs available. However, for the children with special needs, trained dentists and staff were available. UK, patients with the profound disability are treated at the community dental services by the profession who are trained to treat such patients and who are considered as a specialist in special care dentistry. In Australia, services for patients with special needs are well established with their respective regional approach. Malaysia, authorities are working towards setting up centers to attend the people with disabilities. Now, the special care specialty as a specialty, this special care, the term is introduced in 1981 with American Dental Associations. Later in 2003, New Zealand and Australia also introduced in a hospital dentistry, in pediatric dentistry. In 2008, United Kingdom used as a special care dentistry, a dentist with special interest in special care dentistry. In 2016, Malaysia has introduced this terminology. Now, challenges in special care dentistry educations, inadequate educational plan of special care dentistry as a curriculum, lack of training, educational materials, lack of trainers, experts and teachers, lack of infrastructures in terms of dental equipment and facilities, disabled friendly facilities, especially clinical sites or patients. Now challenges coming to the special care dentistry is absence of structured learning objective, teaching methodologies and assessment, special care dentistry incorporated in pediatric dentistry, oral surgery, prosthodontics and community dentistry. As a teaching, behavior management of disability, equality training, workshops, experiences in dental clinic, attitude and skill in geriatric and medical rehabilitation wards, nursing homes, special needs and other rehabilitation centers are needed. What are the features for special care dentistry? Dental professionals of the future need to be able to meet the challenges posed by the healthcare needs. The dental education is a key to improve the field of special needs dentistry through the comprehensive development of a standardized special care dentistry curriculum. The policy makers, the stakeholders and the educators must work hand in and where the education for special care dentistry is a concern. In summary, the special care dentistry is a concern with enabling the delivery of oral care for the people with an impairment or a disability. The training of a dentist who can address the wider needs of the people requiring special care should be developed. These are my references. Thank you.